Hello, I'm Harold Jones, Dean of the School of Health Professions at the University of Alabama at Birmingham. Thanks for joining us today for another discussion in our continuing monthly series where we interview experts in our school. These experts are leaders helping to shape the future of healthcare through tailoring innovative solutions to real-world problems. Joining us today is Dr. Robert Hernandez. Dr. Hernandez is a prominent leader both nationally and internationally in the area of health management education and currently serves as the sole United States representative elected to the European Academy of Management Board, also known as URAM. He is co-editor of the Journal of Health Administration Education and a professor and director of the Administration Health Services doctoral and executive programs in our school. In addition to serving as a longtime faculty member, he's also a graduate of our Health Administration graduate program. Bob, thank you for joining us today.
It's a pleasure.
Bob, you've had a lot of experience in international education and international collaborations. Could you tell us a little bit about your first experience in international collaboration in the educational field and maybe about some of your other experiences since that time?
The United States was interested in helping countries in Central and Eastern Europe develop democratic processes. And their concern was that the leadership of a lot of the systems in those countries really couldn't make good, effective management decisions. So we received a contract to work in Armenia to help the healthcare leaders there improve their decision-making processes. So a group of faculty and I went in to work with hospital executives, et cetera, to improve the way they made decisions. They used to not make any decisions at all because they were waiting for the word from Moscow, which was their way of thinking about central administration telling them what to do. So we worked with them over a number of years and improved the way that they were organized and structured. And then later we were asked to work in Ukraine with some of the leaders of that system as well.
Why is it important for those of us in education, especially us at UAB, to be involved in international healthcare management education? Especially, what is it that we can bring to the table that can help improve the quality of healthcare in other countries?
Most of the people do not receive formal training in management in other parts of the world, and in North America we have probably had the best results in healthcare management training, having had university programs for the last 60 years, which is really an anomaly in the rest of the world to a great deal, to a great extent. One of the things that we are fascinated by is the lack of participation in decision making in these other countries. A lot of these countries have command and control systems where the senior executive makes a decision with a little involvement of others within their staffs. So we've helped them look at broader ways of involving all members of administrative staff in the decision-making process. We certainly are involved a great deal in evidence-based management practice, where you look for what's the best benchmark for decision-making activities, and you use that within the context of the hospital.
You know, you just said that there is not quite the same level of healthcare management education and professional healthcare management individuals in many other countries. Who usually serves the role of leading healthcare organizations in other countries where they don't have such an extensive amount of healthcare management education programming?
In most of the countries, the physicians are in fact the hospital executives, and they rise to the ranks because they're good clinicians, but not necessarily because they're good managers. So they may have little background or experience in terms of management practices. And one of the things that we've helped to structure is a curriculum that recognizes these kinds of clinical leaders, but helps them complement what they have in terms of clinical skills with management skills.
I think I've also heard that in some countries, leading a healthcare system is actually almost a political appointment. Can you share with us any examples of that? And what's the impact of that on the quality of care for patients?
Yeah, one of the things that we found, especially in some of the Eastern European countries, is it's almost like a feudal state. so that people get appointed to be heads of hospitals based on who they know within the Ministry of Health. And that's certainly not an effective way of organizing and leading healthcare activities. So what we've tried to do is establish these benchmarks for educational processes that you can look for qualified skills in leaders who would then be selected to run these organizations.
In our graduate education programs, particularly our executive programs, I know that all of our students take a course in comparative health systems. And in fact, in both of our executive programs, students actually travel abroad to see a different healthcare system. What is it that our students learn from this type of experience, and how does that improve their ability to be good healthcare managers in this country?
Well, you know, one of the takeaways from this is that there is no perfect healthcare delivery system in the world. Certainly we have a pretty good system here in the U.S., but we have flaws. Those in Europe also have flaws. But when we look at the delivery system, it fits the culture of the community in which it's operating. We had a great takeaway from a trip we did to Toronto, Canada once, where the faculty member at the University of Toronto said, in Canada, healthcare is a social commodity and a social responsibility. But in the U.S., it's a market commodity to be bought and sold. And if you think about it, in Canada, they care about the collective and the good for everyone, whereas in the U.S., we think about health care as something to be bought and sold. It's a different way of thinking about how we're structured. It was interesting, too, when we went to Switzerland that their healthcare system is structured much like ours. They require everyone to have health insurance in their country. And we asked, what kind of enforcement mechanisms do you have? And the executives in Switzerland said, we don't have to have an enforcement mechanism. People are told to do it, and 98% of the people in the country will buy health insurance because it's good for everyone to do that.
In the introduction, I mentioned the fact that you are the representative from the United States on URAM. Could you tell us a little bit about what URAM is and what it's trying to accomplish?
We were asked about 6 or 7 years ago to submit a research paper to the European Academy of Management based upon our work in the Ukraine. And we went to their annual meeting, presented the paper. One of the things that we found that was interesting is of all of these management scholars in Europe, no one was doing research on how to best organize healthcare organizations. So we felt like it was critical that if you're going to have better healthcare delivery in Europe, you need to have good research in terms of how to organize, finance, and deliver healthcare. So I worked with some colleagues to develop the healthcare management research track that has now become a permanent part of the URAM community. So now that we have 30 or 40 research papers that are given each year at the annual meeting focusing on how to best organize hospital services in Paris. We've had some papers that have looked at the Netherlands and how do you involve women physicians in practice within that community when they're having to balance personal lives versus professional responsibilities. So it's really been exciting to see this kind of adoption of management research as a part of the overall community of URAM.
Tell me a little bit about your role on the board of URAM.
I am the U.S. representative on the URAM board. There are 3 other countries besides the U.S. that are part of this European community: Canada, Australia, and Brazil. And so we present the view of healthcare management, management research outside of the European community there. It's been interesting because we had a 3-hour board meeting yesterday talking about how to restructure URAM. And I've been fortunate to be involved on a number of boards here in the U.S., and so I bring that kind of experience in working with AUPHA and our accrediting body to how should boards function effectively.
The department's most recent collaboration is with a hospital in Saudi Arabia. Could you please tell me about the nature of that collaboration, what we're trying to accomplish there, and the benefits that it will have for that hospital and for the country of Saudi Arabia?
Yeah, it's interesting. The Kingdom of Saudi Arabia is making incredible financial investments in improving healthcare delivery for their population. They are building a 1,400-bed brand new hospital to replace an older facility in Dammam, which is the eastern province in the eastern province of Saudi Arabia. And so they realized as they're building this 1,400-bed facility that they need to have healthcare managers trained who are going to be effective in terms of providing leadership in that institution. So they contracted with us to provide graduate education, a master's degree, for 35 people who are working within that hospital, so that when they open their doors, our people will be graduating, our people being their physicians and other leaders in their hospital who have been selected for their program, will be in a position to provide leadership for the transition into the new facility. So that's kind of an exciting activity for us. I think the Kingdom of Saudi Arabia is interested in doing this because providing healthcare services for the population will show their people that their leadership is concerned about the public and what they're doing. I think it's also a reaction to the Arab Spring, so that they don't want they want their people to feel like services are being provided to them.
I understand that in addition to individuals employed by the hospital, there are a number of other individuals enrolled in the program. Who are those people, and how may they also be important in improving the quality of health care for Saudi Arabia?
Yeah, the Minister of Health has sent a number of representatives to be part of the program as well. And they've been so pleased with it, they've asked for us to do a second group of 35 students to start in 2014.
Once again, Bob, thank you for taking your time today to share with us your experiences and your knowledge of international collaborations in the area of healthcare management.
Thank you.
To learn more about our health administration doctoral or executive programs, go to our Department of Health Services Administration website at uab.edu/HSA. If you have any questions or comments about this topic, please feel free to contact us at uab.edu/shp/contact. And while you're on our website, be sure to learn something more about our school. Once again, thank you for joining us. I'm Harold Jones, Dean of the UAB School of Health Professions, where we're shaping the future of healthcare through tailoring innovative solutions to real-world problems.